How many practices are using digital pathology? A $10,000 grant opportunity, and a Hill Day newbie shares his experience. These stories and more coming up next. This is Path News Network Daily Edition from the College of American Pathologists. I'm Nancy Johnson. It's Friday, May 8th. AI may be all the rage, but many pathology practices have yet to adopt the tools required to digitize their slides. Of the 378 practice leaders polled in the CAP's 2025 Pathologist Leadership Survey, just 26% said they are digitizing glass slides using whole slide imaging, or WSI, while 74% are not. Among those who use WSI, 57% use it for primary diagnosis. That means that overall, only 15% of pathology practices use WSI for primary diagnosis. The survey also found that the rate is higher among academic hospitals than it is for non-academic, physician office, or government-owned practice settings. The CAP survey, released last month, can be downloaded at cap.org. Also, be sure to listen on Monday for my interview with Dr. John Groth, who will explain how digital pathology will soon provide patients with greater access to their pathology images. The CAP Foundation is offering grants of up to $10,000 for programs that develop, expand, and sustain the delivery of pathology services in under-resourced areas overseas. The projects can promote education and training, patient care, laboratory quality, or enhanced technology and laboratory diagnostics. The Foundation's Global Pathology Development Grant was created to improve global health and promote expansion of pathology and pathology services around the world, in line with the Foundation's mission. The application deadline is July 15th. For more information, go to the CAP Foundation website at foundation.cap.org. More than 1/4 of kidney transplants require dialysis within a week of the operation, a complication known as delayed graft function, or DGF. As researchers look for ways to optimize donor organ selection to improve those outcomes, a new study in the Journal of Applied Laboratory Medicine finds that emerging biomarkers hold promise for early detection, especially if AI tools are used to analyze clinical data from donors. DGF is caused by several factors, including the condition of the donated kidney. Current methods of assessing kidneys do not detect kidney damage that could lead to DGF. And finally, 126 member pathologists visited Capitol Hill last week as part of the CAP's 2026 Hill Day. They held 168 in-person meetings plus 5 virtual meetings with members of Congress or staff. Making sure that pathologists' voices are heard in policy discussions is crucial on such important issues as reimbursement rates and staffing shortages. That's why the CAP strongly encourages pathologists to participate in advocacy efforts at the local, state, and federal levels. One CAP member who participated in his first Hill Day this year was Dr. Samuel Franks, a pathologist at Indiana University School of Medicine. We spoke with him about the experience.
I think I've always had a particular interest in pathology advocacy once I understood a little bit more about our specialty and how complicated and how highly regulated our specialty is, and how many of us are a little introverted, and how the kind of our personalities get in the way of advocating for our pathology specialty sometimes.
Dr. Franks is active in advocacy at the state level. He serves as legislative chair of the Indiana Association of Pathologists, but he wanted to experience what happens in Washington, D.C.
It's the first time I've met a senator or their staff, or a person or their staff, and you realize how their kind of day-to-day workflow. You may see these politicians on TV, but that's not every day. So their day-to-day workflow, you realize how many people are trying to, get their attention, relay their concerns. And if you saw that process firsthand, I think it changes your perception about how you need to advocate for whatever organization, specialty, or issues.
Dr. Franks met with Indiana Senator Todd Young and staff members of Congressman Andre Carson, advocating for improved reimbursement for pathology as well as help with staffing shortages. Both problems lead to reporting delays for test results, a frustrating experience for anyone, including the lawmakers' Indiana constituents. It's a story policymakers need to hear from more pathologists.
I would encourage people to get involved. Like if you like what you're seeing right now, and if you don't have any problems, that's great. But if you have opinions and complaints about where we're at right now, and you want to change that, I think the only way is to get involved somehow. And if you don't have to be it directly, but if you support people that are doing it, I think that's one. There's lots of ways to help. So get involved. Get out there, work with people that want to, resolve or troubleshoot issues like this, and work towards a resolution to create a better environment for your specialty moving forward.
Next year's HOD-PLS is scheduled for May 15th through the 18th. And that does it for us today. For more information on today's stories, check the show notes. And please share this episode on your social media networks. We'll be back Monday at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nancy Johnson. Have a great weekend.